You've probably heard it said that depression is a chemical imbalance, that it's a flaw in your wiring, something broken inside that needs to be fixed or managed. But what if that story is too small? What if depression isn't an error, but a message in a language we've forgotten how to read? Maybe it's not a disease to be cured, but a signal to be reinterpreted. A sign that something deep within you is out of sync, not just chemically, but existentially. And maybe, just maybe, healing doesn't always mean removing the pain. Sometimes it means listening more carefully to what the pain is trying to say. That's where microdosing enters the conversation. Not as a miracle, not as an escape, but as a subtle shift. A way of seeing things, just differently enough. You see, psychedelics have a history that's been buried under decades of fear and misunderstanding. There was a time when substances like psilocybin and LSD were seen as tools for healing, for self-exploration, even for therapy. But then came the cultural backlash. The war on drugs didn't just criminalize substances, it criminalized curiosity. Entire generations were taught to fear what they hadn't even been allowed to understand. And yet here we are again. Researchers at places like Johns Hopkins and Imperial College London are digging through the ashes, uncovering what ancient traditions and early studies already hinted at, that psychedelics, in carefully controlled environments, may not be dangerous distractions, but deeply human tools, especially in small subperceptual doses. But before we can talk about what microdosing does, we need to clear the fog around what it is not. It's not about getting high. It's not about escaping reality or bypassing pain or pretending to be enlightened. It's not about taking a shortcut. And it's definitely not about chasing a chemical version of happiness. Microdosing is something quieter, gentler. It's the art of changing just enough to notice that you're not stuck. Think of it as tuning a guitar string that's been slightly off. Not enough to break the song, just enough to feel slightly off-key. The change is subtle, but over time subtle becomes significant. Because in the brain, even a whisper can start a revolution. At the neural level, microdosing seems to increase connectivity within the brain's default mode network, a system often overactive in depression, looping thoughts endlessly without fresh input. Imagine your thoughts as grooves in snow carved by repetition. Microdosing gently shakes the globe, not to erase the paths, but to allow new ones to form. It's not about fixing your brain. It's about giving it just enough space to imagine alternatives. That matters, because depression isn't just sadness. Often it's stuckness, a kind of inner rigidity, like trying to read a book that keeps returning to the same paragraph, no matter how many pages you turn. Microdosing doesn't offer a new ending, but it might let you see the story from a different angle. People who microdose often describe small but profound shifts, a sense of spaciousness in their thinking, an ability to observe their emotions without drowning in them, a moment of unexpected gratitude. Not euphoria, not escape, just clarity. And here's where the tension deepens. Microdosing and antidepressants exist in very different paradigms. SSRIs, the most common antidepressants, are designed to blunt emotional extremes, to stabilize, to soften, to numb. They can be life-saving, but for some, they come at a cost, a muted emotional range, a sense of disconnection not just from pain but from joy, intimacy, and self-awareness. Microdosing, by contrast, doesn't dull emotions. It heightens sensitivity, which raises an uncomfortable question. Should healing mean feeling less? Or should it mean learning to feel more, but differently? That difference demands a kind of responsibility, because this isn't just chemistry, it's context. In psychedelic practice, there's a saying, set and setting, your mindset, your environment, your intention. These aren't soft variables, they're core to the outcome. And yet in today's biohacking culture, it's easy to forget that, to treat microdosing like a productivity tool or wellness trend, stripped of reflection or ritual. But even small doses can stir deep waters. Without intention, you risk missing the point. Without reflection, you risk turning insight into noise. Without context, you risk reenacting the very patterns you're trying to transform. So let's talk about the risks. Not to scare you, but to keep you awake. We don't yet know the long-term effects of chronic microdosing. There are reports of mania in people with bipolar disorder. There's the placebo effect, powerful and real, which can mask deeper unresolved issues. There's the danger of believing that a chemical insight is growth, rather than a spark that needs grounding. And there's the social pressure. In some circles, microdosing has become a kind of self-help fashion, a way of signaling that you're doing the work without really doing it. But none of this means microdosing is meaningless. It just means it's not the whole answer. Because maybe, just maybe, depression isn't a problem to be solved. Maybe it's a teacher. Maybe it asks not for silence, but for a new kind of listening. Microdosing doesn't erase the lessons. It reorients the questions. It doesn't promise peace, but it might show you where the war begins. And sometimes, that's the most powerful healing of all. Not to escape your suffering, but to meet it with new eyes. To stop asking, how do I make this go away? And start asking, what is this trying to teach me? In the end, the promise of microdosing isn't happiness. It's clarity. Not emotional control, but emotional literacy. Not numbing, but attunement. It's not about correcting your biology. It's about co-creating with it. You don't need a shortcut to avoid who you are. You need a compass that helps you return, with deeper insight, softer judgment, and a little more wonder at the complexity of your own mind. That's not a cure. That's a conversation. And maybe it's one worth continuing.